to turn to some medical news now. Some headlines that are getting attention this morning, including a rise in COVID cases as we head into the fall. Also, new vaccine guidelines to protect against a common virus. Here to break down what we need to know, one of our favorites, NBC News medical contributor, Dr. Natalie Azar. Dr. Natalie,
good morning.
Good morning.
So earlier this year, the FDA approved, and you correct me if I'm wrong, I believe they approved this RSV vaccine for people over the age of 60.
Yeah.
Then yesterday, they announced that pregnant women were also eligible. So tell us a little bit more. Who's eligible for the new vaccine? Who should rush out to get it? Maybe who should not?
Yeah. So first of all, just can we take a moment to appreciate that we're going to head into flu and RSV and COVID season with these tools in the toolbox for RSV that we did not have
that is very
a year
true.
ago.
There were times where you were sitting in that chair and we were really concerned.
Think about it, like the majority of kids by the age of 2 have been exposed to RSV, and we had nothing to protect them, and we had this onslaught of cases. So yes, so there was a vaccine approved for adults over the age of 60, and yesterday the FDA signed off on the same vaccine for pregnant women between gestational age, or weeks 32 and 36 weeks of pregnancy, as well as for individuals who might have underlying heart or lung disease or who are immunocompromised. You know, myself in rheumatology, I'm waiting for my national organization to suggest that our patients who are immunocompromised should get this vaccine. The vaccine can be associated with some significant side effects that they are monitoring for, so it might not be a universal everyone over the age of 60. This is definitely a talk to your doctor one, but nonetheless, very, very good news.
I feel like the symptoms of RSV are similar to a cold.
They sure are.
Yeah, and then also if you're the youngest ones, what do we have, like 0 to 8 months? What do you do for them?
So we talked about this a lot. For the majority of people who get RSV, it is a big nuisance. Runny nose, fever, cough, wheezing, trouble breathing. But in susceptible or vulnerable, especially newborns, because they have such small airways, they can get something called bronchiolitis, which is inflammation or pneumonia. We have a monoclonal antibody treatment that was also approved this year for kids between the ages of 0 to 8 months, and also a little bit older if they still have risk factors. It's a one-time shot in the muscle, and you're basically giving them the antibodies to protect them against RSV.
So often
3 tools.
Those little babies trying to breathe when that gets all swollen. So we've been talking a lot about COVID and the uptick in COVID. Are we back at a point where we should be masking up indoors?
So you know how we used to talk about case counts? We are not tracking case counts. We know that cases are vastly underreported because people are not getting tested as readily as they once were. So the CDC is looking at hospitalizations and ICU admissions, as well as wastewater data to see upticks in COVID. If you are a person who is more likely to get sick, if you live with someone who's more likely to have a severe outcome, or you're really worried about long COVID, should you be masking in public indoor spaces? Go ahead and mask in indoor spaces, on public transportation. I think that's still an independent, personal decision you make on your own risk assessment.
Right. I want to go back to something you just said there, not to put you on the spot. The fact that we've stopped tracking case counts. Why is that?
Because think about it. The vast majority of us, or maybe not, you have a sniffle, you have a little sore throat, you get better in a couple of days, you never test. That's what's happening. And
it's harder to test now.
It is harder to test. You said it took
yesterday, I have a cold. I just wanted to be careful. Yeah, I waited 45 minutes in the minor emergency room because all the tests were gone.
Yeah, and when the public health emergency ended, you're no longer guaranteed to get reimbursement from insurance companies. Those tests are expensive.
Yeah.
So that's why.
COVID booster, it's expected to be approved later?
Yeah, it's supposed to be approved and be available by the 2nd or 3rd week in September. And we also had this recent study about which arm should you get the booster in. And somebody actually looked at this. See, we have people who are very interested in these things. And they found that there was a slightly better response if you got the booster in the same arm that you got your previous vaccines in. Do you remember how we used to talk about, like, you could get a swollen lymph node and stuff? It's all about, like, where that immune reservoir is. So if you have the option, maybe get it in the same arm.
Wow.
Immune
like
reservoir.
all coming back.
Do you like that immune reservoir?
Like that.
Okay.
Natalie,
you're paying attention.
Thank you.
You're going to go see patients now, too, aren't you?
I am.
God bless you.
Busy woman. All right.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.